Josephine was born, and we had a wonderful pediatrician who noticed something day one. She had glassy looking scales on her arms and legs, and then when they went to do all of the measurements of her, they discovered specifically her left leg and her right arm were shorter than the right limbs.
We had a genetic consult on day 2, I think it was, while we're still in the hospital.
And a barrage of x-rays and tests.
The genetic counselors at the time thought that they knew what it was even without actually doing a blood test. Turns out they were right. They kind of got it right on the first shot. Josie has chondrodysplasia punctata type 2.
It's an X-linked chromosomal disorder, which we discovered through genetic testing. She actually got from me, but it manifests so mildly in me that it doesn't disrupt my daily life.
We work with both an orthopod and as well with Dr. McClung-Smith in neurology to keep track of long bone growth, spinal, as well as cranial positioning and firmness.
One of the problems that children with dwarfism wind up encountering is that their head grows at a different rate than the rest of their body. And one of the problems that can cause is hydrocephalus, or too much water on the brain. It can also cause compression or pushing on of the spinal cord or the brainstem. I get to follow Josephine along to make sure that if she does start showing signs of brainstem compression or too much water on the brain, that we're able to intervene in a timely fashion. There's multiple types of dwarfism. I think that the type people are most familiar with is the chondrodysplasia, because it's the ones that show up in the movies. In her case, she has a different form of mutation. In some cases, the mutation causes someone to have a very large head and a short stature. Some cases they may just have a short stature and be more proportionate. Some cases also come with other skin conditions, hair loss. There's multiple factors that go into what we follow for dwarfism, and that's part of the reason why you need a multidisciplinary approach.
In terms of what they're expecting, there will probably be some kind of surgical intervention for long bone treatment throughout her life.
It's a little bit more tricky in her case because with her, the long bone that's affected on her and her leg, it's her femur. The bone itself is growing at different rates on each side. So the bone is growing curved. So one side is growing faster than the other. We have to gather data and wait and see if that is going to even out over time. And then they'll start doing the intervention surgeries.
More than likely she will be small. However, they're very confident that they'll be able to even out the discrepancy so that she'll be able to move and be very active in a normal fashion. She desperately wants to keep up with her older brother and sister. They are not that much older than her. She's 2.5 now, and they are 4 and 5.
We've really worked hard to make sure that she doesn't feel different from them, that she's functioning at the same level and she's meeting those milestones and she doesn't feel encumbered by this. Josie is highly intelligent, strong-willed, which they tell me is very good for her therapy. She's just a lot of fun.
Josephine is an amazing little girl. She's smart, she's sweet, she has this incredible little personality that she is developing more and more every day I see her. And getting to participate in her care is a true joy.